Hello everyone, I'm Shivani and this video is in the continuation of the series all about the therapies. And in this video, I'm going to take up the occupational therapy. So let us understand first that what is occupational therapies. Uh, in occupational therapy, what happens is like if a person is lagging behind physically, sensory wise or cognitive wise, so those all aspects are taking into care. uh, the therapist, what they will do, they will give enough practice to the brain so that they are able to overcome these sort of problems. Now, how it is related to autism, ADHD, and CP, and in respect to our kids, what will happen is they will be basically lagging behind in these areas only, like physical issues like low muscle tone, or they will be not having good fine motors or motor skills. They will be not having that efficient. So in those, the occupational therapy will be helping. Also the sensory issues, basically ADHD and autistic kids, they will be having a lot of sensory issues. Either we will be seeking too much of sensory input or too less. Either one of is bad. So occupational therapy will help to create one balance. Also the cognitive wise, if the child is lagging cognitive wise, the occupational therapist will do those sort of activities with the child which will enhance the brain, like they will be doing sorting, or they will be doing this puzzles and all, and they will know how, what are the tricks and techniques to enhance that particular cognitive uh, portion of the child. Okay, so how do we go forward with the occupational therapy? How as a parent we should understand it? Generally what happens is that the first thing doctor will suggest is occupational therapy, that each day you have to do occupational therapy for the child. And what we will be expecting, that okay, we will do occupational therapy for 2 months or say 6 months, and the child will be okay. But it depends, it actually depends on the child, that how much occupational therapy the child needs. If the child is having very minor issues in the physical, sensory and cognitive aspect, too much of occupational therapy can that it won't be that good as well, because we should know that what is the requirement of the child. And see, autism spectrum, it is a spectrum, like each and every child will be different. So we cannot expect that what worked for some other child will be working for my child, because our child's needs can be different. So for that we have to do one proper assessment. We need to take the help of the therapist and ask that what are all the issues the child is having and what are the things we need to focus on. Then according to that we will see. And if a particular thing, what we will have to keep in mind, that if a particular sensory issue is there in the child, how much is the therapy helping is it. Suppose if the child, if you have taken the same therapy for like 2 months or 3 months, and still you don't see any change in that particular thing, like physically or in sensory wise or in cognitive wise, you're not seeing that particular change. So it's better to start reducing it and see like if something else can work. Okay, so as a parent we have to be that much vigilant enough that we are able to keep a watch on the issues our child is having, and then give a help accordingly. Because simply just taking it to the occupational therapist and then not then not being conscious enough about that what the occupational therapist is doing or is telling will not give that much result. I mean, if the child is having some other issue and the therapist is working on something else, that will not be beneficial. So we have to be aware like what are the issues are by asking to the therapist simply. That is the only way. Just ask to the therapist, okay, what is the things what are the things you think that the child is lagging, and what are we going to focus on for the next 1 month, 3 months, 6 months. Okay, you can ask, and how, what can we expect. Okay, so these kind of things you ask the occupational therapist. And first of all, you also do an assessment, like okay, this is the thing the child is lagging, and this is how we are going to it. Okay, now this sensory, physical and then cognitive, okay, all those aspects you will have to seek where the child is lagging and how we are moving. Okay, next thing is that as a parent, what all you should be doing. uh, whenever you go to the therapy center, be conscious that the therapist is doing only the therapy only for like a short duration of time, like maybe 45 minutes or maybe 1.5 hours or something like that. More than that, the children won't be cooperating with the therapist, so they will not do. Or they are doing once in a week, twice in a week, or they are doing 6 days a week or 7 days a week, how they are doing. So you have to be conscious. But whatever the therapist is saying that you have to do at home, you will have to do it. Otherwise, the first thing will happen that the child will forget whatever they are doing. They will forget. If they will not forget, then the effects will be not that significant. So it's like similar for us also. If we are learning some particular new skill, the more and more we do practice, the more easily we will learn. Okay, so you just take the help of the therapist and create a home plan and do all those activities at home regularly. Like if the therapist is saying that this thing you have to do 3 times a day, you have to do it at least 2 times a day. I mean, 3 times, sometimes it won't be possible for all the parents or guardians because it becomes too hectic. Otherwise, sometimes it happens that whole day you are doing therapy only at home. So that also is not good. But you will have to create a home plan that, okay, this 2 hours, I have to do these occupational therapy activities at home. And depending on your child, you can give rest in between and all. You have to do. Okay, and be mindful that if 2 days or 3 days a week the therapist is saying is taking the class, but that won't be enough for the child, because if you're not doing the same thing at home, it will again regression will come and the child won't improve with that much pace. Other thing is that especially be careful about the sensory things. Whatever sensory input the child is having, you have to make sure that the child is not doing those things at home. Like once you are aware, you are asking, you after having a consultation with the therapist, you will come to know that, okay, these are things, for example, spinning, hand flapping, or like putting pressure like this, they will be doing sometimes. Or if they are seeking a particular kind of vision or something they are seeking, just ask and have a discussion around that with the therapist. And once you are aware, don't allow the child to do the same at home, because if the therapies are being done for 45 minutes in a therapy center and then 2 hours at home you are doing, and then remaining whole time the child is getting involved in the sensory thing, that will not go. That will, even if the sensory requirement is not there for the child, it will become like a behavior and they will not get out of it. Okay. In occupational therapy, I just there are few extra things also which occupational therapist will be helping you out in. Like if particular kind of texture of food the child is not eating, in that also you can ask the occupational therapist to help you. Then behavior wise also, there are minor behaviors coming here and there. I know there is a separate behavior therapy also they will be doing, but I guess according to my experience, it can be more or less controlled with the help of occupational therapist and the at home. So if both of you are working in coordination, you can control a lot of behaviors as well. Then physiotherapy, lot of activities which physiotherapy therapists are doing are similar to what we are doing in occupational therapy. They will be doing in occupational therapy. So if there is no major physical issue with the child, I mean, it's different for the case in cerebral palsy and other things. But if in autism and ADHD there is no major physical issue with the child, you can also take the help of occupational therapist in the physical aspect, and that should be enough. Okay, coming to the next point. Yeah, so and the last and the most important point which I want to make is like have a goal. Just discuss with the therapist that what are the goals for the child, what are the issues they are focusing on initially. Maybe when you start the occupational therapy, you can give a little bit time to the therapist so that the rapport building happens and all. But after 15 days, just have a goal plan that, okay, within a month, these all issues will be reducing. And don't have like, it will go, that issue will go, or this will improve 100%, or if the child is not climbing stairs, the child will just run through the stairs. That, no, it depends on children to children. So don't make that kind of goals. Just make it like it will improve by 20% or say by 30%, or like the child will give eye contact 3 out of 10 times, something like that. Just minor goals you make, but just try to follow it with the occupational therapist and see it. And if the therapist is allowing you to sit with the child while they are doing the therapy, please do that. Please do that. Just see how the therapist is working and how the child is responding with the therapist, and what are the techniques. Sometimes if we notice how they are speaking also, that also really helps, because sometimes what instruction we will be giving to the child and how the therapists are giving are totally different. So just try to see what kind of voice modulation they are doing, how they are showing that particular thing to the child. Like if the child is not having eye contact, the therapist will like bring that thing in just front of the eyes and show, and they will brighten their eyes. What kind of expression the therapist is doing with your child, and it will be different for each child depending on the requirement. So if you get that opportunity, just make best out of it. See what the therapists are doing, implement the same thing at home, and be regular in the OT activities and everything. Okay. So this is what all I had for occupational therapy. See you in the next video. In next video I'm going to take up the stem cell therapy. Okay, thank you.